All right, now on to our Health Watch, where we discuss all of the topics trending in the medical world. And as always, we're joined by Dr. Syed Hussain of Trinity Health of New England. Good to see you again, doctor.
Likewise.
Once a doctor, always a doctor. He goes, hey, you're sounding a little sick. I just have a little bit of a head cold. But yes, so you're always looking out for people. I do appreciate that.
Sure.
Okay, hey, we're not talking about COVID much. That's a good thing. But we do have some new problems, a lot more rare, popping up. Babesiosis. We're talking about a rise in cases of that. It's probably the first that people have heard about what this is. And if they haven't heard, can you tell us how much of a threat is it and what is it?
Yeah, babesiosis is a tick-borne illness that can cause flu-like symptoms. Tim, it can run the entire gamut from mild symptoms to severe. In very rare cases, it may be fatal, but it's treatable, though, with antibiotics that are available. Folks need to be aware of this condition, especially in the Northeast, where it's endemic. So if you're going camping or hiking, especially spring, summer, fall time, then you need to make sure that if you're, going to doing any of these outdoor activities, you use proper precautions. Right. So you cover your legs, you avoid long grass, you use tick repellent, for instance. And if you develop any symptoms such as fever, headache, muscle aches, joint pain, then it's always good to see a provider to get tested.
It's related to malaria, so the symptoms, not that people know malaria symptoms,
sure,
but you get the basic idea. You mentioned endemic. That means it's been around here for a while.
It has.
I guess cases have grown over the past decade. Do we have any idea yet why?
Yeah, not 100% sure. The CDC reports that cases have gone up from 2011 to 2019. The relatively still small numbers we're looking at, 16,000 total cases during this time period, but something that folks need to be aware of as we approach the warmer months.
Right, and that's why we do this. Another thing, Candida auris. This is a fungus, not a parasite, but the CDC seems like it's worried about it. Why?
This is something as a clinician I do get worried about, Tim. This is a superbug. So we've discussed superbugs in the past. This is a fungus that basically has tripled over the last few years during the course of the pandemic as our eye has shifted towards controlling the pandemic, making sure COVID-19 patients were taken care of. The disinfectant practices that should be top of mind, have slipped somewhat, and this fungus has grown. Now, in normal people, it doesn't really pose much of a threat. It's those that are vulnerable, those that have multiple medical problems, admitted to the hospital, in a nursing home setting, it can spread rapidly. And some strains of Candida auris are actually resistant to all available modes of treatment, so it's worrisome.
Yes, that certainly is. And like you said, especially in those congregate settings and in hospitals where people are probably sick anyways, you have that. I mentioned we weren't talking about COVID much. Ha, I lied. Bivalent boosters look like there could be another round, I guess, for people with certain conditions or weakened immune systems. Where do we stand with that, and why do we even need more boosters?
Yeah, so just to inform viewers of where we are with this. So bivalent vaccine, COVID-19 booster was approved last fall. Data indicates that the immunity from this booster may be waning around 6 months. So the UK and Canada have actually gone ahead and approved a second bivalent booster for those individuals that have already gotten it and it's been more than 6 months. And they also are higher risk, so age, multiple medical problems. Those people are now eligible. Yeah. The FDA and the CDC have not yet weighed in, and so it remains to be seen what happens, how this works out in our country here. Right. But the Pfizer also has submitted an application, Tim, to make this vaccine fully approved, which would mean then the CDC would have the ability to let doctors decide when and if how frequently this should be given.
Okay, so that's something we're going to have to keep an eye on. Remember, we've always talked about the difference between full approval and emergency use authorization, so that's the difference we could be seeing coming up. Doctor, thank you so much for joining us again. We'll do the fist pump for hygiene's purposes. And